Next, let's discuss the symptoms and clinical presentation. Postpartum blues present with mild depression, tearfulness, and irritability, usually peaking around day 5 and resolving by day 14. In contrast, postpartum depression involves more severe and prolonged symptoms such as intense sadness, sleep disturbances, changes in appetite, low energy, difficulty concentrating, and feelings of worthlessness or guilt. These symptoms last for at least 2 weeks and significantly impair daily functioning. Postpartum psychosis is marked by delusions, hallucinations, bizarre behavior, and thoughts of harming oneself or the baby. These symptoms can appear suddenly and vary greatly in intensity. Now, let's move on to how these conditions are diagnosed. Diagnosing these conditions involves careful screening and clinical evaluation. Healthcare providers should routinely assess new mothers during postpartum visits using standardized screening tools like the Edinburgh Postnatal Depression Scale. A detailed clinical history and physical examination are crucial to rule out other medical conditions. In cases of suspected postpartum psychosis, a psychiatric evaluation is essential. Imaging and laboratory tests are typically not required unless there is a suspicion of an underlying medical issue contributing to the symptoms. Next, let's discuss management and treatment. Managing postpartum blues usually involves reassurance and monitoring, as it tends to resolve on its own. For postpartum depression, treatment options include psychotherapy and antidepressants, with selective serotonin reuptake inhibitors, or SSRIs, like sertraline being preferred, especially in breastfeeding mothers. Support groups and parenting skills training can also be beneficial adjuncts. Postpartum psychosis requires immediate medical intervention with antipsychotics, antidepressants, and mood stabilizers. Hospitalization is often necessary to ensure the safety of both the mother and the infant. Preventive measures include regular screening during pregnancy and postpartum, providing robust support systems, and educating families about the signs and symptoms to watch for. Next, let's consider a case study. Let's look at a 30-year-old woman who presented at her 4-week postpartum checkup with severe depressive symptoms. She reported persistent sadness, insomnia, lack of appetite, and feelings of worthlessness. A thorough assessment confirmed postpartum depression. She was started on sertraline and referred to a therapist for cognitive behavioral therapy. Her symptoms gradually improved with treatment, and she was able to bond with her baby and engage in daily activities more effectively. This case underscores the importance of early diagnosis and intervention in managing postpartum depression. Finally, let's summarize the key points. In conclusion, postpartum blues, depression, and psychosis are significant conditions that require timely recognition and appropriate management. Early diagnosis and intervention can drastically improve outcomes for both the mother and the infant. We encourage you to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards for a more effective study experience. Thank you for tuning in to Med Madness, and we look forward to bringing you more valuable content in our next episode. Stay informed, stay prepared, and let's continue to make a difference in medical education.